Now, the White House revealed President Trump has chronic venous insufficiency. So here to explain more about what that condition is, vascular surgeon Dr. Stuart Harlin from UTHealth Houston and Memorial Hermann-Katy. Good morning, Dr. Harlin.
Morning, Haley. How are you?
Good. Great to have you here. So tell us more about what is this condition that the president has? Is this a dangerous condition?
It's not dangerous. It's actually kind of common. About half of all adults have some sort of venous insufficiency, and it's just mainly from standing up all your life, and certainly more prevalent in ladies than men. It's chronic venous insufficiency is a progression of that problem, and it can lead to swelling, discoloration, rash, and in some cases even ulcers and stuff like that on your lower extremities.
Would you say, if it is that common, that maybe not a lot of people realize they have it, or they just kind of dismiss the swelling?
That's exactly right. Venous disease in the absence of acute DVT is usually kind of insidious and chronic and just gets slowly worse over time. And a lot of people think that's just a sign of aging. And it's truly not. It's insufficiency is a truly mechanical problem within the veins of your legs and can slowly, cause problems over time.
So does that mean that it is important to get treatment? And what would that treatment look like?
Really, for most people, the treatment is just being active and not a whole lot more than that. When you move, any way you move, the muscles in your calves contract and helps push blood back to your heart against gravity. So really, for our patients, we endorse activity of any kind, elevation at night to help any swelling go down, maybe compression stockings. And only in people who have symptoms beyond those means do we consider intervention.
Yeah, it sounds kind of like, when you're on an airplane, you can have like pooling in your legs and you're being told to like squeeze your calves and move around and do stuff like that. So are you supposed to do like kind of similar movements, like maybe when you're seated to be moving your feet around and squeezing your thigh muscles?
Exactly. And even those kind of simple things, like you see people who have the little exercise wheels that they sell on the infomercials.
Oh, yeah.
So even simple little things like that for people who aren't quite as mobile can make a lot of difference in how they do over time. So really any activity, and for our patients, I would say, walk, swim, bike, yoga, Pilates, anything that, where those muscles are moving are a big benefit over time.
Right. Yeah. So should there be any concern from the public for President Trump's health?
I'm sure he has the best medical care available in the United States. So I'm sure they're quite on top of it. And they've already endorsed all the things we've talked about. I've read that he's already had an ultrasound, so I'm sure they're aware of whatever mechanical situations he has. But beyond that, he's a very active man to begin with, so I'm sure that he does those things already. I likely has compression stockings and those things as well.
Sounds like it's a pretty benign diagnosis. Dr. Stuart Harlin, are there any other options for people here in Houston? Any other treatment options that you would recommend?
Oh, yes, ma'am. For people who are symptomatic beyond, the conservative therapies, the therapies have really improved over time. In the old days, it was all vein strippings and surgeries like that, which are quite medieval. And the therapies now are all entirely non-invasive or minimally invasive, catheter-based procedures where you put a little widget inside the vein and close off the offending valves. Those are done almost entirely in office-based procedures. People can go home right after they're done. Those are very successful for people who need intervention.
All right, and people can find you at the Memorial Hermann-Katy. Dr. Stuart Harlin, I appreciate your time this morning. I love that you were able to log on and give us some insight into this diagnosis.
Thanks so much for having me. Sure appreciate it.
All right, we appreciate it as well. Thank you so much.